Hello everyone, this is Dr. Abhinav, and in this video today we'll be discussing about the ESIC Insurance Medical Officer exam that was held on 2014. So here I am discussing the previous year question paper of ESIC exam which was held on 2014. So later in this video I'll also tell you about where I got this question paper, the source and all those things. So for today what I will do is that I will discuss only the questions and the answers. Because of my schedule, I couldn't discuss it with the explanations. But later, after a few days, if you need, we'll discuss with the explanations also. Now, this is the booklet A that I will be discussing. So this is Insurance Medical Officer Grade 2 exam, 200 questions and held for 2 hours. So if you see here, they have given there shall be no negative markings for wrong answers. So let's start the solving the questions. So I'll be solving according to the answer key that has been given, but there were a few mistakes that were in the answer key. So I've highlighted a few in that also. And if you also notice any mistakes that we have been solving here, please do drop it down in the comment section. We'll find the correct answer for it. So let's start. In a lady with a threatened abortion, which of the following would not be useful with intact membrane? The answer is antibiotic prophylaxis. Which of the following is the best to assess endometrial cycle? Answer is hormonal profile. Which of the following is not seen in human beings? Answer is estrous cycle. A 18-year-old patient presented with primary amenorrhea. On examination, her breast and external genitalia are normal. She is most likely suffering from, answer is MKH syndrome. PCOD predisposes to the following except increased risk of ovarian cancers. The A wave in the jugular venous pulse is produced by atrial systole or atrial contraction. Answer is B. Calcium channel blockers are used in the treatment of hypertension include nifedipine. So all the dipines, amlodipine, nifedipine, all those are calcium channel blockers. Most important predictor of coronary artery disease is HDL. So LDL is also an important, but compared to LDL, HDL is more important. CURB 65 includes severe azotemia. The agent of choice in controlling heparin-induced bleeding is protamine sulfate. Northern blotting is used for analysis of RNA. So remember, north is for roti, so RNA. South is for dosa, so DNA. Southern blotting DNA, northern blotting is RNA. Rapid infusion of insulin can cause hypokalemia. Digitalis toxicity enhanced by the adverse effects of hyperkalemia. Best test for intestinal malabsorption, D-xylose test. Plasma urine creatinine ratio of 20:1 may be seen in pre-renal failure. So the answer they have given here is pre-renal failure, but in pre-renal failure it's more, urea creatinine will be more than 20:1. So please do check this answer. Low calcium and high phosphate is seen in hypoparathyroidism. Here the answer key they have given hyperparathyroidism, but low calcium and high phosphate is usually hypoparathyroidism. The most effective contraceptive method recommended in lactating mother is progesterone only pill. What is the drug of choice for emergency contraception? So levonorgestrel only pill. Most characteristic presentation of fallopian tube carcinoma is excessive watery discharge per vaginum. Feto-maternal transfusion is detected by Clay-Hoyer's PET test. So answer A. The drug used for medical management of ectopic pregnancy is methotrexate. Infants born to mothers who are heavy drinkers and are at risk of which of the following problems? So alcohol is mental retardation. The estimated risk of uterine rupture in a woman with a previous lower segment uncomplicated cesarean section is approximately 0.5 to 2%. Test for ovarian reserve. So answer is FSH. Most common nerve involved in the fracture of surgical neck of humerus. So answer is axillary nerve. So in children, all are true except with thick periosteum, soft bone dislocation or rare. Yes. Comminuted fracture are common. No. Comminuted fractures are uncommon in children. Most common nerve involvement in Oxman ischemic contracture is answer is median nerve. C. The principal steroid secreted by testis is here they have given testosterone. So please do check this answer. Pacemaker regulating the rate of respiration is pre-Botzinger complex. Hot water bottle relieves pain of abdominal spasm by stimulation of adrenergic fibers. Insulin secretion is inhibited by epinephrine. Here they have given. Please check this answer also. Nitric oxide is synthesized by arginine. A 55-year-old overweight female was given fentanyl pancuronium midas anesthesia for a surgery. After surgery, she was extubated, and on examination, her chest wall respiratory motion was slow, and she was unable to move her upper body. She was conscious and able to understand what was said, but was lacking respiratory effort. Her BP was normal, heart rate was normal. What is the diagnosis? So diagnosis is fentanyl-induced chest wall rigidity. Protein is purified using ammonium sulfate by salting out. Leishman syndrome is caused by the deficiency of HGPRT. In C-reactive protein, the C stands for C polysaccharide of Streptococcus. Rothera's test is used for detection of ketones. Milkman's fracture is a type of pseudofracture. Complication of Colles fracture include all of the following except. So, non-union. Answer is non-union. Most common site of scaphoid fracture is waist. Left superior vena cava drains into coronary sinus. Urogenital diaphragm is made of the following except Colles fascia. Hybrid or composite muscle include all of the following except flexor carpi ulnaris. Gluteus medius is supplied by superior gluteal nerve. Celiac plexus is located anterolateral to aorta. In severe exercise, carbon monoxide increases up to 5 times, while pulmonary blood pressure rises minimally because sympathetic stimulation causes greater distensibility of pulmonary vessels. Non-respiratory function of the lung. Sodium balance. Hot fermentation relieves the intestinal spasm by inhibition of cold receptors. 40-year-old patient was brought with recent onset personality changes and behavioral problems. He had diarrhea since few days. On examination, there was hypersalivation and blue lines were noted on gums. Fine tremors were also noted. There is no organomegaly. What is the most likely diagnosis? Mercury poisoning. Mechanism of injuries caused by lightning include all of the following except one. Compression effect due to compression air waves striking the abdomen. This is not the effect. So this is exception. So we'll continue with question number 51. Morphine can be used in all of the following conditions except head injury. All are antiemetics except phenazocin. A patient is receiving linezolid therapy for 14 days. Which of the following should be monitored? So we'll monitor platelet. Toxicity of amphotericin B can be reduced by using liposomal preparations. Which of the following can cause acute pancreatitis? Didonosin. Reflex which is not present in child at birth is answer B, symmetric tonic neck reflex. Most common cause of sepsis in India within 2 months is E. coli. So this is old question, old update. So check for the new update also. A case of jaundice with 50% of direct bilirubin and other LFT is normal. Diagnosis is Rotor syndrome. Infant of diabetic mother with weight 3.8 kg presented with seizures after 16 hours of birth. What is the probable cause? The answer is hypoglycemia. Electron microscope is diagnostic in Alport syndrome. Drug of choice in theophylline poisoning is phenobarbital. Which of the following drugs has been found to be useful in acute severe asthma? Magnesium sulfate. Parathyroid hormone increases bone resorption. Buspirone is an anxiolytic. Oxygen content in anesthetic mixture is 33%. Alcohol intake during pregnancy causes all except brachycephaly. Which teratogen causes deafness? So answer is isotretinoin. Digoxin toxicity is increased by all except hyperkalemia. So previously we had a question regarding digoxin toxicity. So the answer probably digoxin toxicity is probably increased by hypokalemia because of the sodium potassium ATPase binding channel. But previously they have given the answer as hyperkalemia, and now again increased by all except they are giving hyperkalemia. So please do check these two questions. Thylectomy literally means excision of a lump. Most common histological type of thyroid cancer is papillary type. Best test to diagnose gastroesophageal reflux disease and quantify acid output is 24 hours pH monitoring. Most common cause of gastric outlet obstruction in India is cancer of stomach. Most common infection after splenectomy is pneumococcal infection. Most common type of choledochal cyst is type 1. Best prognosis for carcinoma of pancreas is seen in region of periampullary. Colpotomy is done to treat pelvic abscess. So, parastomal hernia is most frequently seen in loop colostomy. Best investigation to diagnose piles is proctoscopy. Z-score is used in normal distribution curve. True about corneal transplant is specular microscopy is ideal for endothelial count. Retinoblastoma is associated with osteosarcoma. Topical mitomycin C is useful in the treatment of tracheal stenosis. Laser used in laryngeal work is carbon dioxide laser. Following can be visualized on bronchoscopy except subcarinal nodes. Down syndrome most commonly occurs due to answer is non-disjunction in maternal meiosis. Which of the following is not associated with increase in risk of seizures in future in a child with febrile seizures? So answer is early age of onset. Which of the milestone developed first? So answer is mirror play. At a 6-year-old child with IQ of 50, which of the following can the child do? Answer is identify colors. Which of the following is the best indicator of long-term nutritional status? Answer is height for age. Indicator of moderate to severe malnutrition is albumin 2.1 gram per deciliter. Craniotapes is seen in which of the following? Seen in the following except. So answer is thalassemia. So indicator to moderate to severe malnutrition. Answer is albumin 2.1 gram per deciliter. So here the answer best indicator long term height for age. This one albumin 2.1 gram per deciliter. Craniotapes is seen in all of the following except thalassemia. Anti-infective vitamin is vitamin A. Abnormalities of copper metabolism are all implicated in the pathogenesis of the following except abnormalities of copper metabolism are implicated in the pathogenesis of all of the following except. So answer is Cation disease. A 2-year-old child is brought by parents with history of seizures and developmental delay. He has multiple hypopigmented macules over his back. This is the most probable diagnosis. Answer is tuberous sclerosis. Following can be used in treatment of myoclonic seizures except carbamazepine. Commonest cause of ureteric injury during surgical operation is hysterectomy. Bladder tumors mostly arise from mucosa. Answer is A, mucosa. Semen analysis of a young man who presented with primary infertility revealed low volume Fructose negative ejaculation with azoospermia. Which of the following is most useful imaging modality to evaluate the cause of his infertility? Answer is transrectal ultrasound. Optical urethroplasty is done in congenital stricture of urethra. Most common testicular tumor in prepubertal adults is yolk sac tumor. Which of the following is the best parameter to assess fluid intake in a polytrauma patient? Answer is urine output. Orthobaric oxygen is used in carbon monoxide poisoning. Which of the following is microaerophilic? Answer is Campylobacter. All are methods of sterilization by dry heat except autoclaving. False regarding bacterial plasmids is can cause lysogenic conversion. Insulin secretion is inhibited by epinephrine. Effects of bradykinin includes pain. Mitochondrial effects of bradykinin includes here they have given answer is pain. Please do check this answer also. Mitochondrial enzyme in liver is SGOT. Pink color in Rothera's test. So answer is ketone bodies. Prenatal diagnosis of hemophilia can be done by answer is B, cytogenetic analysis. Gout is a disorder of purine metabolism. BMR is increased in all of the following except physical activity. BMR mainly depends on lean body mass. Mechanism of action of theophylline phosphodiesterase inhibition. Allopurinol is used in the treatment of gout. B cell maturation takes place in bone marrow. Culture media for leptospirosis is Korthoff's culture media. All of the following statements about chlamydia trachomatis are true, except penicillin is the treatment of choice. So the following literally means flow of seed. So flow of seed is gonorrhea. Conjunctivitis is caused by all except CMV. Cloudy swelling is due to accumulation of water intracellularly. Basement membrane degeneration is mediated by metalloproteinases. Sago-spleen is seen in amyloidosis. Salt-losing nephritis is a feature of interstitial nephritis. All are of adult size at birth except maxillary antrum. Goblet cells are present in trachea. Most common cause of death after total hip replacement is thromboembolism. Bouchard nodes are seen in proximal interphalangeal joints. Which of the following is not a primary skin disease? So, Reiter's syndrome. An otherwise healthy male presents with a creamy curd-like white patch on the tongue. A probable diagnosis is candidiasis. In spinal anesthesia, the drug is deposited in pia and arachnoid matter. Which among the following is not used for surface anesthesia? The answer is tetracaine. Which is a hinge joint? So hinge joint is elbow. What is agoraphobia? So agoraphobia is fear of open space. Best diagnosis for dissecting aorta is MRI. But please do check this one. So MRI or angiography. So here they have given 135 is B MRI. So please check. Egg on side appearance is seen in uncorrected TGA. So best investigation in acute cholecystitis is HIDA scan. So which of the following heart sounds occur shortly after S2? Except ejection click. Enlarged pulsatile liver is seen in tricuspid regurgitation. Cardiomyopathy may be seen in all of the following except alkaptonuria. Test for reversible cardiac ischemia is thallium scan. So test for reversible cardiac ischemia is 140 is thallium scan. So most common cause of right ventricular failure is, so answer is massive pulmonary embolism. All are causes of pulmonary hypertension except hyperventilation. Which valve is least affected in rheumatic fever? So answer is pulmonary valve. So a patient presents with tachycardia, BP less than 100, systolic and postural hypotension. Diagnosis is bleeding peptic ulcer. How do they say this bleeding peptic ulcer? Please do comment in the comment section. So left ventricular hypertrophy is caused by all except, so mitral stenosis. Calcium gluconate is not used in CPR by hypokalemia. 28-year-old woman has limiting cutaneous scleroderma for the last 10 years, complaints of shortness of breath for last 1 month. Her pulmonary function tests are as follows. They are given here. So what is the most likely diagnosis? So here interstitial lung disease. Most definitive method of diagnosing pulmonary embolism is pulmonary arteriography. All of the following features are seen in viral pneumonia except predominance of alveolar exudates. MAO inhibitors should not be used with, answer is petidin. Imatinib is useful in the treatment of CD117 positive GIST. Toxicity of amphotericin B can be reduced by using liposomal preparation. Which of the following form of steroid base is most potent? So answer is ointment. Treatment of choice for patients with meningococcal meningitis who is allergic to penicillin is chloramphenicol. If a patient receiving linezolid therapy for 14 days, which of the following should be monitored is platelet monitoring. Characteristic features of apoptosis is cytoplasmic eosinophilia. Following are granulomatous vasculitis, except is Burgess disease. Bronchiectasis is most common in which lobe? Answer is left lower lobe. True about lung carcinoma. So answer is oat cell carcinoma is commonly associated with bilateral hilar lymphadenopathy. Not a cause of hemoptysis. His answer is empyema. Rampal, a 45 years old man, presents with a history of recurrent hemoptysis and purulent sputum. His chest X-ray is normal. Which of the following will be the next best investigation for him? So HRCT. Smoking is generally not associated as a risk factor for bronchiolitis obliterans or organizing pneumonia. Which of the following collagen disorder is not commonly associated with pulmonary fibrosis? Answer is dermatomyositis. Which of the following disorder is not true about the autistic specific disorders? So answer is vision problems. A school-going boy was noted with a vacant state several times a day. There is no history of fever, seizures, neurological deterioration. What is the most likely diagnosis? The most likely diagnosis here is absent seizures. True about Wilson's disease. Answer is increase in urinary copper and decrease in serum ceruloplasmin. Most common cause of genital ulcer in HIV patient is herpes. A 60-year-old female was given anesthesia for a prolonged surgery. After surgery, she was extubated but was found to have poor respiration, BP 180, and blood analysis revealed CO2 200 and the blood pH was 7.42. What is the most likely diagnosis? The most likely diagnosis is incomplete recovery from muscle relaxants. Which of the following is not a behavior therapy technique? Answer is counter transference. Vaginal sphincter is formed by all except internal urethral sphincter. Osteometal complex refers to, so answer is A, maxillary ostium, ethmoid infundibulum, hiatus semilunaris, and frontal recess. Muscle spindle detects length. Which of the following is not true about the idiopathic pulmonary hemosiderosis? Answer is eosinopenia. A truck driver has chronic cough with fever since 1 month. Chest X-ray shows bilateral reticulonodular infiltrates in mid and lower zones. Which of the following is possible diagnosis? So answer here is pneumocystis carinii pneumonia. All of the following conditions are observed in gout except deficiency of enzyme xanthine oxidase. Most common organism associated with reactive arthritis is chlamydia. All of the following are true about Raynaud's disease except positive anti-nuclear antibodies. The following condition is not associated with an increased anion gap type of metabolic acidosis. Answer is COPD. Positive urinary anion gap is found in renal tubular acidosis. The cause of resurgent malaria are all of the following except increase in number of Plasmodium species. So the following disease is inherited only in males. Answer is X-linked recessive. True about antiphospholipid antibody syndrome includes following. So answer is bleeding. Which of the following tests should be first done in non-mismatched blood transfusion reactions? Answer is direct Coombs test. Beck's triad. So here answer is cardiac. Beck's test used for is seen in cardiac tamponade. True about third heart sounds. Here due to contraction of right ventricle. Drug used in management of migraine includes all of the following except. So answer is ethosuximide. Serotonin syndrome caused by the following except chlorpromazine. Pathology in motor neuron disease is at anterior horn cells. Brown tumor of bone is seen in hyperparathyroidism. Primary impact injury most commonly involves legs. The path of which following bullet can be followed after shot from gun is tracer bullet. A 30-year-old female married 5 years back died. Under which of the following autopsy of this patient should be conducted? So answer is CRPC 176. Rural-urban difference is not seen with tuberculosis. Please check this answer also. Mass immunization is indicated in the following except leprosy. ASHA stands for Accredited Social Health Activist. They have given the answer itself, Accredited Social Health Activist. JSY stands for Janani Suraksha Yojana. Which of the following predisposes to atherosclerosis? Answer is hyperestrogenemia. Most common oncogenic human papilloma virus is HPV-16. Most important investigation in VVF is cystoscopy. Is vesicovaginal fistula. The answer is cystoscopy. So here we have discussed the 200 question of 2014 ESIC IMO question paper. So I've got this question paper in the ESIC website itself. In official website, they had a recruitment page. So I'll show it. So if you see here, this is the ESIC website. So here the number 38, they have given all the 2014 question paper A, B, C, D. They have given 4 series. And here recruitment of insurance medical officer that is currently going to happen. You can check this also. So in the website, they've given the exam was held on 2014. They have given this question paper. So that was all about this video. So if you want explanation, please do let me know in the comment section. And there are also few mistakes in the answer key. So please, if you find any mistakes, please do note in the comment section also. We'll discuss about it. So that's all. If you haven't subscribed to our channel, please do subscribe. Thank you.